If you've been prescribed antibiotics for pelvic pain, taken the full course, and ended up with the same symptoms you started with, or felt slightly better for a week, and then found everything coming back, I want to explain clearly why that happens. Because it's not bad luck. It's not that your case is especially difficult. It's a mismatch between the treatment and the actual cause of the problem. Here's the clinical picture. Prostatitis, the umbrella term often used for male pelvic pain, has 4 distinct categories. Categories 1 and 2 are genuinely bacterial, confirmed infection, positive cultures. Antibiotics are exactly the right treatment. These account for roughly 5 to 10% of all cases. Category 3 is called chronic pelvic pain syndrome, or CPPS. No infection is found, cultures come back negative, and this is the one that accounts for around 90 to 95% of men who present with chronic pelvic symptoms. Antibiotics don't work for CPPS because CPPS isn't caused by bacteria. That sounds simple when you say it out loud, but it means that the most commonly prescribed treatment for male pelvic pain is, in the majority of cases, the wrong tool for the job. So what is causing it? The most consistently identified drivers in CPPS are pelvic floor dysfunction, chronically overactive muscles that develop trigger points and refer pain to the perineum, the lower back, the testicles, or the tip of the penis, and nerve sensitization, where the nervous system has been in a state of pain signaling for long enough that it has become hypersensitive. Stress, posture, movement habits, and the way the body has learned to guard around the pain all compound those drivers over time. None of those things respond to antibiotics, but all of them respond to the right treatment. What that treatment looks like is a proper specialist assessment, not a 10-minute GP appointment that maps exactly which factors are driving your specific symptoms. Then a treatment plan built around releasing pelvic floor tension, retraining muscle coordination, and where appropriate, using focused shockwave therapy to address deeper myofascial dysfunction and reduce inflammation in the pelvic tissues. The evidence for this kind of multimodal approach is genuinely stronger than for antibiotics in CPPS. Studies show that between 50 and 80% of men see meaningful symptom improvement with the right specialist treatment. That's a very different picture from another course of antibiotics. At Mayo Health Clinic, an assessment for pelvic pain runs for 90 minutes. That gives us the time to actually understand what's going on, not just run a urine test and reach for the prescription pad. If you've been through the antibiotic route and you're still in pain, the most useful next step is a free, confidential discovery call. No obligation, just an honest conversation about your situation and what would actually help. The link is below.